Good evening. Health officials say a deadly virus from the Middle East has turned up in the U.S., and that person who has it is right here in Indiana.
Middle East Respiratory Syndrome, or MERS, first surfaced 2 years ago in Saudi Arabia. Since then, there have been a little under 400 reported cases, and around 100 people have died. News Channel 15's Aaron Rodgers joins us with tonight's top story.
It's still not known how this virus originates, but it does have a 30% mortality rate, and most patients are middle-aged.
A deadly virus from the Middle East has made its way to the U.S., and the first and only reported case in this country is in northwest Indiana.
It's new, and that always is something different and for people to be concerned about, but I think we're prepared to, like I said, readily contain it.
MERS-CoV is a lower respiratory disease similar to the SARS virus. Symptoms include a high fever, cough, and shortness of breath. But it's so dangerous because it can develop into a serious lung disease.
Something called contact and droplet and airborne transmission. And basically for the general public, people may need to wear masks around a patient. You may want to put them in a room where the airflow is protected and doesn't spread.
The patient was working in a healthcare facility in Saudi Arabia. On April 24th, he left there and flew to London, then from London on to Chicago, and took a bus from Chicago to Munster, Indiana.
We're all a plane ride away from diseases that we don't think we have to worry about on a regular basis.
Health officials say they are contacting people who are on the bus and plane with the patient, but that others should not panic.
If you've just been in Chicago or northeast or northwestern Indiana, you don't need to worry about being potentially exposed. I think the risk of that is extremely low.
There is no vaccine, so it's important for people to be proactive and wash their hands and disinfect public surfaces.
Now, because it is early on in the investigation, officials are still not releasing many details about the case in the U.S. We do know the patient is stable, but still hooked up to an oxygen machine. We were also told that people shouldn't change their travel plans because of this. Aaron Rodgers, News Channel 15.